In the name of God, most gracious, most merciful, we would like to welcome the speakers to this press conference of the National Medical Task Force for Combating Coronavirus COVID-19. Dr. Walid Al-Mani, Undersecretary of the Ministry of Health, Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, and Dr. Jamil Al-Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live on TV and on the YouTube channel of the Ministry of Health in 5 different languages, and we also have the journalists and reporters joining us remotely. Now, as usual, we begin with Dr. Walid Al-Mani, Undersecretary of the Ministry of Health. In the name of God, most gracious, most merciful, praise be to the Lord who has held everything within his knowledge. Praise be to him for his countless blessings and grace, and praise be to the Prophet. We welcome you again in order to inform you on the most recent updates regarding dealing with COVID-19. First, we would like to announce that as a precautionary measure and in order to maintain the objectives of the country, and following the approval of the Executive Committee, we have announced that we are going to maintain the yellow level until Monday, 14th of February 2022. And we confirm that this decision comes as a precautionary measure in order to maintain the health and safety of citizens and residents. And we confirm the necessity that everyone should implement the yellow level measures and that all the inspections are ongoing in order to maintain the safety of everyone. And any violators will have actions against them. And we announce everyone who are eligible to take the booster dose to go immediately to health centers which were announced previously without any previous appointments. It's important at this stage in dealing with this virus to have awareness, because with the increase of the active cases now is normal, but what we need to do now, we need to focus on those who need treatment or those who are critical. The rates are really low locally due to the success in implementing all the measures through the national campaign for vaccination and the other procedures. To conclude, it's important to take a PCR test whenever you experience any symptoms in order to maintain the health and safety of citizens and residents. Now I'll leave the floor to Lieutenant Colonel Dr. Manaf Al-Qahtani. Thank you very much, Dr. Walid Al-Mani, in the name of God, most gracious, most merciful. First, I'd like to confirm that the health and safety of citizens and residents has always been a priority for us in all the stages of dealing with COVID-19. The national campaign, which comes to protect the health and safety of everyone from the beginning and up to now, many protocols and studies were updated, and allow me now to compare the increase in the number of the active cases and, thank God, the vaccination rate. And I remember in May 2021, with the increase of the active cases, if we compare those who needed to be hospitalized or to be in ICU, or the death rates from May 2021 and up to now, January 2022, I think the figures are clear we have huge difference between the need to be hospitalized before and now. We have reached a higher rate of vaccination. I think it's time to say that with figures now, that vaccines with all their types have proven to be effective and important in maintaining the health and safety of citizens. Confirms, as we repeat always, the importance to take the vaccines. Countries who provided the vaccines as the World Health Organization encourages to take the booster doses, as it is effective in creating and raising the immunity. So every human has different capabilities in creating antibodies, and as we are witnessing a pandemic and we have variants, it's normal to have booster doses. And thanks to the community awareness and the initiative to take the vaccines, as we really appreciate the awareness of Bahrainis and residents, we have reached a success, as those who took the first and second doses reached 96% of those eligible who are 18 years and above. And those who took the booster dose are 84% of those eligible. As we have seen the effectiveness up to now, although the active cases are high, but the symptoms are really less. Also, Bahrain has achieved success for kids vaccination. As for those who took the vaccine from 12 years old to 17, 91%. And for those 3 years old to 11 years old are 17,000 kids, and more than 25,000 kids for those kids eligible. That's why we send our sincere thanks to parents for their responsibility, and we call upon those who have not yet took their kids to take the vaccines, please take it now, because this will support the national efforts in order to get out of the. And we confirm that the vaccination and the booster doses have proven that they are decreasing the symptoms of the COVID-19. And again, we call upon all those eligible to take the vaccines to take the doses. And now, before concluding, after passing 2 years, we have the question, is the vaccine important? The answer is yes. The vaccine is important because the local studies, international ones, in reality have proven that the vaccines contribute to decreasing the symptoms of COVID-19 and going into ICU or to be hospitalized, or even the long-term symptoms, in which we have 25 to 30% of the population around the world are still experiencing those long-term symptoms. And I think more than 90 billion doses have been provided to the population. And if we compare the symptoms compared to the 2 years ago, we say it's nothing. So this makes us say that those who are a bit suspicious, and let's look into the reality, let's look into figures in Bahrain and outside, that the vaccines are not only effective but also important. So to conclude, in order to protect yourselves, families, and societies, for those who did not take the vaccines, please take the initiative in all the doses, including the booster doses. May God protect us. Now I'll leave the floor to Dr. Jamil Salman. Thank you very much, Dr. Manaf Al-Qahtani. In the name of God, most gracious, most merciful, peace be upon you. Welcome again to this press conference. And today I'm going to talk about the recent updates regarding dealing with COVID-19. I'm going to talk about three important points. First, what has been announced by Dr. Walid a while ago to maintain the yellow level until 14th of February 2022, and we note that the updated mechanism for the traffic light depends on the average of those cases in ICU. And we note that the task force can make a decision anytime based on any updates. So the standards for the traffic light system can be changed to cope with the updates of the virus. The second point, which is really important, about updating the quarantine protocol, which counts on the green shield holders. For those who have green shield, they must implement the quarantine for 7 days from the date of the infection, and there is no need to repeat the PCR test on the 7th day. As for those who don't have the green shield, whether yellow, red, or not vaccinated, they must implement the quarantine for 10 days from the date of the infection, and they don't need to take the PCR on the 10th day. The third point, which is also really important and mentioned by Dr. Walid Al-Mana, the importance of taking the PCR test whenever experiencing any symptoms of COVID-19, which are similar to flu. This is really important in order to reach those cases at an earliest stage and isolate the contacts and the infected cases and decrease the number of the active cases in Bahrain. And to conclude, we wish everyone good health and success, and please implement all the precautionary measures and decisions in order to continue the efforts in the Kingdom of Bahrain to combat COVID-19. Thank you. Thank you very much, the speakers, for your briefs. Now we move to the questions sections. Question from Mahmoud Rafiq, 24/7 News, to Dr. Walid Al-Mana. Based on the traffic light system, is it true that the percentage of active cases are over the red yellow from 2 weeks ago? If yes, then why haven't we moved to the red level already? Thank you for the question. Well, we already announced that the assessment in the Kingdom of Bahrain, yes, part of the assessment is the active cases, but the assessment is not only on the active cases, it's also on their need to go to be hospitalized, and also if they are critical and went into ICU. So if we assess our situation, if they are like 10 or 11 in critical or 10 hospitalized, then we're not going only into yellow, we're like green yellow. So we count on those who need treatment. This is the important thing. So yes, we see the active cases increasing into 3,000, 4,000, but thank God there is no need to be hospitalized, although we have this. So as mentioned by Dr. Manaf a while ago, what we say the community immunity that the vaccination has given its effectiveness. And in the Kingdom of Bahrain, we have seen this in reality, that they don't witness the complications of the disease. And maybe with the active increase in the active cases, but this is not the only assessment, because the immunity we have and the vaccination from before, the awareness of people in implementing the measures made them not need to go to hospital. So shall we go into red? I think we are yellow as precautionary. So this is just precautionary in order to maintain our objectives. That's why we extended the yellow level into the next stage. Thank you. Question from Raji GDN to Dr. Manaf Al-Qahtani. The global reports show that the Omicron variant is spreading among kids and children. Is it the same in Bahrain? Yes, well, everyone knows that the new variant called Omicron, which was characterized as spreading quick and causing those, especially among those who are not vaccinated. And if we compare kids and children, since the beginning of the Omicron identification, we counted the cases of kids in order to compare them with the others. So we conducted a study in 5th of January to 22nd of January. We collected all the children 1 year to 17 years old, and around 46 of them went to hospital out of the total number, but 46 needed to be hospitalized. So how many of them were kids who are less than 12? The majority were non-vaccinated. So 80% of those cases from the 5th of January to the 22nd were kids who are less than 12 years old who needed to go to hospital. Thank God they were stable. They didn't need to go into ICU, and their admission was 2 days to 3 days. So this is something comforting, but we know it in the epidemiology, things could change from now and tomorrow. So the question is always asked, shall we just get the infection as it's mild now? This is wrong, because this could lead into complications. It's important to know how this virus interacts in our bodies. But we well know that the vaccine interacts well in our bodies. So for those who say it's better to take the virus in our bodies, this is a wrong theory, especially for those who did not take the vaccine. So those who got the virus got complications. So yes, we've seen the Omicron because Omicron goes into the upper side of the body. That's why it spreads quickly. Let's stick to Dr. Manaf, the same context from Bana. Does the current stage need to have kids be vaccinated? And what is the risk? Well, is it compulsory for kids? And the effectiveness? Well, as a guardian, as a parent, the first question for me, especially for kids, more than effectiveness, is it safe on kids? This is more important to know, because we've seen with the complications of the virus on kids are less, and this is a bless from God. Let's look into the reports. One of the reports issued by the Canadian organization, they compared the complications of COVID-19 with the muscle of the heart, and they compared it with those who got the virus. With figures, they had only 2 cases with 100,000 vaccines for all age categories. They only 2 cases experienced weakness in the muscle of the heart. 2 out of 100,000. If we compare them to those who got the infection, they had 150 muscle weakness in the muscle of heart for those who did not take the vaccine. So you can see the safety of the vaccine. So we say, before the effectiveness, we need to look at the safety, and it is safe. And let's look into our long experience with vaccines for hundreds of years in Bahrain. We've seen that we did not experience any long-term symptoms for kids. So these 2 points are important for parents to know, that the issues of the virus are more than the vaccines, which are really less. Now, as for the compulsory vaccines, well, in Bahrain, if we have 91% of the age category 12 to 17 who are vaccinated, I don't think there is a need to make it compulsory. We have awareness already from this society, from parents. And thank God, since the announcement for registration for the kids, we had 8.8%, and we already have registered kids. So just to make it short, I don't think we need to make it compulsory in Bahrain, because we already have awareness in Bahrain, and the figures already prove the effectiveness and safety of the vaccines, and it is one of the tools to get out of this pandemic safe. Another question from Raji from JDN to Dr. Jamil Salman. When the Paxlovid pills to be provided in Bahrain for the public? Thank you for the question. It's really important at this stage in dealing with COVID-19. For 2 years, the medications for the virus are little. Remdesivirs, we used this one in certain cases, especially the middle and mild. As for this medication, would reduce the creation of the virus, and it's used for the mild and medium, and it's proven to be effective, and there is initial results that it decreases the need to be hospitalized by 88%, and this is encouraging. So they don't need to go to hospital. Patients can only take the pills at home for 5 days, and this medication has been approved to be used in Bahrain, and we're waiting to be shipped, and we're updating the medication list based on the scientific and international studies. So once approved to be effective, it will be added. So yes, it has been added. We're waiting for it to be shipped to Bahrain. Thank you. Question to Dr. Walid Al-Mana from Tamam Busafi. Are all active cases, including those in critical, are with Omicron? And if so, is vaccination in Bahrain with 88% enough? And are the symptoms of Omicron are mild, although the increase in the active cases shows there is a wide spread of the virus? First, just to let you know, the variants are changing. Once we have a new variant, so we started with Alpha, then Delta, then now we have Omicron. And in epidemiology, whenever we have a new variant, it takes more active cases than the before one. So if we had Alpha, Delta took more than of active cases, more than Alpha. And now with Omicron, it's normal that it will take the rule of Delta. So it was severe. So if we ask, is Omicron? Yes, this spread will be more than before. And as we said, the symptoms will be little mild and the spread is quickly. But we go back again to link these variants with the percentage of the vaccine. Do I need the vaccine or not? Dr. Manaf already mentioned that vaccines are important, and that it's wrong to think that if the symptoms are less, then we don't need to take the vaccines, because we might have complications in the long term and we might have other issues. But the vaccines is really important. Whenever we had a variant, we follow up, we check in order to make the appropriate decisions, and the same thing with the vaccines. You notice that we had more doses, so we just stopped with one dose or two doses or just a booster dose. Some categories already needed fourth dose because we believe this is the weapon and it's effective in stopping the disease and reducing the symptoms. So yes, the increase in the active cases is not the only assessment, but let's look into those who are hospitalized, those in critical. Thank God they are few. So we're still counting on the weapon of the vaccines and to follow up more onto it. And in Bahrain, thank God, we have achieved great success in dealing with the complications and their issues. And hopefully that this is a message: vaccination, vaccination, vaccination. Because implementing the precautionary measures and taking the vaccines, regardless of the variants types, will have a great impact on people. So we cannot just think about taking the virus and not taking the vaccines. Well, if you take the question is, can we be infected while being vaccinated? Yes, but you will have less complications. So hopefully this is a clear message for the benefit of everyone. Well, now we conclude the question and answer section. Thank you very much to the speakers for your briefs, and thanks also go to the journalists and reporters and for you, ladies and gentlemen. Before concluding, kindly be reminded to follow all the precautionary measures and guidelines to mitigate the spread of COVID-19 and combat it. Thank you very much.